Welcome to the Hashimoto's Doctor podcast. You're now part of a growing community of people determined to take their health back through education and self-empowerment. But because of the healthcare system today, we don't have access to the types of healthcare that we want. So we have to do things differently. We've got to do things smarter, and we do that by becoming our own advocates. This podcast will give you the perspective and thoughts of one of the world's leading Hashimoto's doctors. So let's get started. Hi everyone, Dr. Shook here. I hope you're doing well today. In today's podcast, I want to talk to you about a very important and confusing subject, and that is the topic of iodine and iodine supplementation with thyroid disorders and thyroid dysfunction. There are a lot of different opinions on this, and I want to try to give you my perspective. I'm not saying that what I'm telling you is exactly what you should do or shouldn't do. This is my opinion. I'm going to cite some literature and share some of my thoughts with you and the thoughts of a lot of other people that have studied this and made it their life's work to study it. So let's talk about iodine. Most people that have thyroid dysfunction, if they've looked into trying to use supplementation to help themselves, they have inevitably stumbled upon the idea or the recommendation of taking iodine, and I'll tell you that iodine is a double-edged sword. Okay, and what I mean is that high and low iodine can create problems for you, and they're both high iodine levels and low iodine levels are associated with low thyroid status or hypothyroidism, and there are different mechanisms for both of these, depending on if you're low or deficient, or if you have too much. There are different things that can occur. And one of the things that that's been done is that there have been studies done where they looked at urinary output. That's one of the best ways, I think, to evaluate iodine, is to do a urinary test and look at the excretion, the amount that you excrete. Preferably over a 24-hour period. That's how I like to do it. I think that's one of the best ways that we can evaluate your iodine status. And one of the studies that was done showed that both low and high iodine excretion were associated with hypothyroidism. So the interesting thing about this is, a lot of people, if you have Hashimoto's, which if you're listening to this, you're either interested in it, or you may have Hashimoto's and you're trying to figure out how to help yourself, and you've probably come across both perspectives. People saying, if you've done any research, very much research, and it's okay if you haven't. I'll try to give you direction and clarity. If you've come across any significant research, you've done any significant research, you've probably seen that there's recommendations to take really high doses of iodine if you have Hashimoto's, and then there are other people that say don't use any iodine at all, and then there are people that are more moderate in their approach, and they say, hey, we understand iodine's essential, but let's be very let's be conscientious of some of the risk factors here, and let's use it at what we think are more in a more reasonable and responsible way. And that's kind of where I fall. I mean, I think that especially with Hashimoto's, there's a lot of risk. We know for sure, with the research that's been done, there have been a lot of population studies done where people didn't have any, listen, everywhere that there's not an industrialized, the country's not industrialized around the world, in countries that are not as where they don't have fortified food supplies, their food supply is not fortified with iron like we have, and I'll talk about this, but in general, the general population in the United States, they use iodized salt. Now, there are a lot of people that listen to this podcast, and a lot of people that are trying to help themselves. There's the sea salt craze and all different types of salt, and those aren't fortified with iodine. But one of the things that they did with their food supply was they put iodine in the salt so that everyone could get iodine. And in countries where the food supplies are fortified with iodine, the leading cause of hypothyroidism is not iodine deficiency, but everywhere else around the world, that is the case. Hypothyroidism is driven by iodine deficiency. Everywhere else where you don't have fortification with iodine supplementation. So but the interesting thing is there are population studies where they've had good data and information on the entire population of a country, different different areas of China, Iran, Sri Lanka, several places around the world. I think there are areas in Africa. I mean, there are several population studies. We have numerous studies where this has been seen and observed, where the food supply is iodine is introduced and the foods are fortified, and there is a spike in Hashimoto's thyroiditis, the autoimmune thyroid condition where the immune system attacks the thyroid. Now, the hypothyroidism levels did decrease, but there was a spike in Hashimoto's, the autoimmune thyroid condition. Now, so you look at that and you say, well, okay, well, it helped people that were hypothyroid. Yeah, because those people were deficient in iodine. But there are also some risk factors, and there are some scenarios, and I'll share with you in a second what needs to be done in combination with iodine supplementation. And we'll talk a little bit more about, potential levels that I think are reasonable to utilize. But I want to say this first and foremost, you want to evaluate your iodine levels. That's really what you want to do. You want to evaluate your levels of iodine, and you want to do some things in combination with iodine supplementation at a reasonable level of iodine supplementation, and that's my opinion, to try and address this potential problem and to do it right. So we know that high intake of iodine increases the risk of Hashimoto's. Okay, now I'll tell you that there was one of the studies that let me just mention. I'll mention two studies to you where I got some of this information. So there's this was published in Thyroid, a journal, Thyroid, in May of 2001. So we've known about a lot of this. We've known this, but a lot of physicians don't read literature. They don't read the literature. They don't have time to. It's not that they're bad people. They don't have time to read their own journals because they're constantly seeing people and trying to help people, and they're overworked, and they want time. If they're going to have any time for their family or a life, you can't just research all the time because there's an explosion of research. So just want you to know, there's a lot of information that we have known for a while, but there's just more and more studies that are being done now that further reinforce our ideas here. So this was published in Thyroid, the journal Thyroid, in May of 2001. Environmental iodine intake affects the type of non-malignant thyroid disease. It's one of the studies where I got some of this information. Another one was published in the Journal of Pediatric Endocrinology and Metabolism in April of 2009, and the study is titled Excessive Iodine Intake and Ultrasonographic Thyroid Abnormalities in School Children. So, very interesting. Some of this information that I'm sharing with you came from there. I don't want this to go too long with you guys today, so that we can get it in. We might have to do this in a 2-part podcast. But so when you look at iodine deficiency and around the world, there is these maps are published. You can just Google map of iodine deficiency, world map iodine deficiency. If you're just curious, and you'll see that massive areas of Asia and are very deficient. Some areas that have significant deficiency. I would say Australia has pretty significant deficiency as well. You look at areas of Africa, but the U.S. is less. I mean, we're talking a lower amount of people. Percentage of the population has deficiencies of iodine, but definitely Asia, Africa, Australia is pretty significant. India is pretty significant, but China, North America, South America, Alaska. I mean, there's a lower percentage, but it's still a problem. Okay, it's still a problem. And you know what? Quite frankly, I see a lot of the people that I work with when I work with people one-on-one. They've investigated a bit, or I'll say, and I mean this with no disrespect, they've dabbled in trying to figure out how to help themselves. I mean, they don't have, their job, everyday people, their job is not like mine. Like, my job is researching this stuff and trying to make sense of it, and that's what I do all the time, every day, and working with people clinically, and I've gone through a lot of it myself. So I don't expect you to understand or have the time to do what I do. But so a lot of people have tried, because they want to get better, they've tried to help themselves, and they've removed all the iodine from their food. And so we'll see people going on these specialized diets, and they consume just sea salt. And you know what? I consume sea salt, and I consume different types of salt. I don't have iodine in my salt. I actually take a supplement that covers a lot of the bases that I need. And I'll talk about that in a minute. But really important to understand that most people now that are trying to help their thyroid, they're going on specialized diets, they're cutting out all the iodine. So now we're seeing people that are trying to help themselves with hypothyroidism, they have no iodine intake. And they tend to be, a lot more of them tend to be deficient now. So it's really interesting to see kind of like this knee-jerk reaction, which I think is appropriate for some people. I mean, there's studies that show that the avoidance and elimination of iodine has, and I'll have to find the study, but it resulted in euthyroid status in people that had Hashimoto's. So I mean, their numbers returned back to normal. There was a study. I'm pretty sure I've got that, and I've talked about that in a previous podcast. I don't have that right off the top of my head, so I'm not looking at that now. I'm kind of just sitting here looking over some of these papers and some of my thoughts on this. So anyway, I'll try to find that for you guys and share it with you maybe in another podcast. Let's see. Do I have time to continue? So we're at about 10 minutes or so. How about this? How about we do a part 2 study? I'm going to talk about the NAIN study. I'm going to talk about vegetarian and vegan diets. You know, I think this is something I just kind of touched on. We'll talk about iodine excesses, and then we'll go, you know, I'll expand a little bit more on it. But let's wrap it up here so that you guys, we're not going too long. I try to keep my podcast short enough that you can listen to them without being completely bored to death. So anyway, I appreciate you guys. If you have any questions, let me know. You know, it's my mission is help you help yourself, right? Help you change your life, because if we can do that, we can have a positive impact on your family. Ultimately, that will change your community, and that will have a ripple effect on the world. So one person at a time. That's my goal, and I want you guys to be better educated, right? I want you to be able and be an active participant in your healthcare, right? Not adversarial. To be your own advocate, though, right? To be your own advocate, be better educated, be an active participant. You don't have to know everything, but you can ask questions, right? You can ask questions, be an active participant, and then I want you to be better partners with your healthcare providers, not adversaries. There's too much of that. A lot of people get information, they listen to someone like me talking, or they read books, and then they go into their doctor and they throw all this stuff at them, and they expect their doctor to know everything, and they don't. They're not trained in this. This is a whole different, specialty of area of expertise. Your doctors don't know this stuff. Many of them don't. Some of them may be somewhat familiar, and guess what? You're going to be met with a ton of skepticism. You know why? Because they're trying to protect you. So please go in with the right state of mind. These people are, your doctors are good people, right? They're good people. They're trying to help you. Believe me, a lot of people think that doctors may go into medicine for the money. You haven't seen the real side of medicine. If you think that that's the case, you go into medicine. You know what? People that go into medicine are more, you might come to the conclusion after you've seen behind the scenes a little bit that they're maybe just gluttons for punishment, or maybe they made a mistake, because it's not as easy as you would think. You're dealing with people's health, and you're really trying to do what's best for people, and it's not always it's never really straightforward, and it's very emotional as well, because people need help, and you're trying to help them, and you can't always do that. So anyway, be better, be partners, guys. Be partners. Move forward with gratitude and positivity, and we can make a difference, okay? But I appreciate you guys hanging out with me today. Look forward to talking to you again on the next podcast. If you have any questions, you need anything, please don't hesitate to reach out to me and my staff. We'll do everything that we can to help you. But listen, this is going to be part 1. Part 2, let's go into iodine a little bit more. We're going to talk about some other studies and kind of reinforce a few of the things we talked about. But I guys appreciate you hanging out. Hope you have a wonderful, wonderful day. Talk to you soon. Thanks so much for listening. We hope you enjoyed hanging out behind the scenes with Dr. Shook. You can also talk with and learn from Dr. Shook through Facebook Live on our Facebook page at the Office of Dr. Brad Shook. Don't forget, you can also get access to our videos, guidebooks, and thyroid programs at www.drbradshook.com. Oh yeah, and don't forget one more thing. We can change the world one person, one family, and one community at a time. Until next time, remember, today is your day, and no one will tell you who you are and what you can be.